Good evening, everybody. Welcome to AV's Dental Academy here. So today we are going to briefly orient you about the MORTH orientation process. And today we have the speakers, Dr. Keerthi and Dr. Aravinth from India, Tamil Nadu. They are successful orthodontists here. Dr. Keerthi is my UG batchmate. I have known her since the year of 2010. And Dr. Aravinth, I have met him in a casualty where we had to treat a common friend during he just got injured here. That's how I got introduced to Dr. Aravinth here. So we'll be briefly going through the process of how the MORT process works, and that's what these two speakers are going to talk about. At the end of the session, you will have a chance to post your queries, and requesting all you to be on mute so that there are no any interferences. So Dr. Keerthi, the screen is all yours. You can start your session.
Thank you, Vinay.
Sorry, I can't do that.
I hope my screen is visible and I'm audible.
Yes, it's visible.
Yeah. So welcome all of you from AV's Dental Academy. So this is Keerthi, senior lecturer from Ramchandra Dental College. So I am certified with the Royal College of Surgeons, Glasgow. So this program, Mastering MORT, a guided path to success. So it's to say the brainchild of Dr. Vinay. So he's been very keen on this program, so where he wants to enlighten other people to take the Royal College path. So why MORT, if you have to ask anybody who's certified this question? So it's a very prestigious degree to hold for anybody all over the globe. So it's from the Royal College. So what else do you want? So that is all it says. So it has a lot of value when you're trying for job opportunities abroad. After your master's in orthodontics, when you're trying for your job opportunities abroad, or even when you are in India, the value that you get as an MORT certified orthodontist is way more than an MDS graduate. And when you get certified with the Royal College, so we get to attend their exclusive conferences for the MORT holders, and then we also get to be a part of their election process, and we also get to attend their ceremonies, diploma ceremonies, and other processes. So in brief, we have 4 Royal College, so the Edinburgh, Glasgow, England, and Ireland. So the Edinburgh exam is separate by itself. So the Glasgow and England exam together is called the bi-collegiate degree. So when you write this Glasgow exam, it also gives you the England degree. So you can apply for membership, and the Ireland follows thereby. So you can apply for membership with Ireland. So if you're going to write this Glasgow exam, so it means you're going to get yourself certified with 3 of the Royal Colleges. So we have 2 components to this exam. The first component is MCQ and SAQ based. So multiple choice question and short answer question based exam. And the second component or part 2 is scene cases, where you are going to present 3 of your own cases treated by yourself. So you're going to present 3 of your cases. And next is unseen cases, where they will be giving us some cases for us to be presenting, and OSCE section. So I'm going to be restricting myself to elaborate to you about part 1. So Dr. Aravinth will be telling you about what part 2 is. Okay. So before we apply to part 1 exam, okay, we have to go to the Royal College website and find their email ID on the website, and we have to write an email to them with our application forms. So we are going to have 2 application forms, one for the part 1 and one for part 2. In case you don't plan to sit both part 1 and part 2 together, you can just apply both together at once. Later sit for your exams for part 2. But the application process, you can do it off together. So once you download your application process for part 1 and for part 2, in addition to that, you'll be requiring your degree certificate of MDS, and also your proofs you'll be required. In addition, you'll also have to submit your resume, where you have to enlighten in your resume about your cases that you have dealt with, the variety of cases that you have dealt with over your years of orthodontic practice, your publications. All these give more weightage to your resume when you apply for this process. Mainly, your cases speak better. So once you apply by email, uh, they will send you a formal email that your application is accepted. After that, they will be sending you the payment link whenever the exam is there. So only after the exam date is announced, they'll send you the payment link. Right now, they will not be creating you a ID. Okay, they will send you even if you're interested now, the exam dates are not announced as yet. So even if you're interested now, you can do the application process and keep it ready. But they will send you a mail once the exam date is finalized. Then you will be asked to make the payments. The fee structure for part 1 exam is £500, and we have variety of books to cover for the part 1 exam. So the first book that is very important for this exam is Laura Michelle. Trust me guys, if you're going to read this book in and out, then your part 1 exam is sorted. So this is a very basic coffee table book for any orthodontist, and it gives you an insight about all different treatment modalities, diagnosis, treatment planning, and how the approach is different from India. So I wouldn't say it's greatly different, but yes, how we are trained to look at is a little different from what they look at in UK. So that is the main idea that we have to gain while studying for this exam. So what are they expecting is what is important more than what you know. So if you are having an idea of what they are going to expect, then your exam gets sorted out very easily. So this book is going to tell you what and all is their approach to any case. So this is Introduction to Orthodontics by Laura Michelle. Okay. So the next book, so I've specifically mentioned saying for exam, this is the main book. The others are just a read-through book. This is Oxford Handbook of Clinical Dentistry. So in this book, you'll have about the GIC and then the legal components to any orthodontic practitioner, any general dentist, about all the different dental techniques and all. So you can just read through this book, for you to answer the MCQs better. Then you have a Handbook of Orthodontics. This is also just a read-through book for you to understand their concept better. Then, of course, all of you would have seen this book throughout life. So this is Profit. So if you have read Profit through in your life, so that also sorts our exam out. If not, just have a glance through Profit. Your questions will mainly be based out of Laura Michelle, but Profit is for main hardcore knowledge when you answer your Viva questions in your part 2. So if we move on to our next component of the part 1 exam, so we have the MCQ component. We also have the SAQ component. So the MCQ component is going to have 50 questions. Okay, so that's going to be the first section of your exam. So this part 1 exam is a computer exam. So it's not a physical or a paper exam. So it's an online exam. So you're going to have 50 questions, and you will also have a video camera that's running. So for you to be tracked onto the device so that you cannot move on to any other tab or any phone, any surrounding structures nearby. And your computer will also be screen shared so that you can stay only on that window. You cannot use any other tab on your computer also. So once you begin the exam process, your exam is for 3 hours duration. So the first section is going to have 50 questions, which is MCQs, and your marks is going to be doubled to get a percentage. Okay. So the second section, you will have a break. If you don't take the break, it will just automatically get skipped. So you can take a break if you want. So the next component will be SAQ section. So in the SAQ section, you're going to have 10 questions marked out of 10 marks. So that will be converted to percentage again. So they will be individual questions and you'll have some sub questions which are going to be split up as 10. So you have to answer to the point in your SAQ question. Just because it's a short answer question, you don't have to write a lot of words and cover up the answer paper or anything like we conventionally do. You don't have to do that. On point, precise answer for the short answer question. If it's a 2 mark, they would have mentioned the mark in the side for each question. How much is the mark in an SAQ section? So be precise to the point. If they mention marks as 2 in the side, mention 2 points. If they mention mark as 4, mention 4 points. And all in words. You don't have to write multiple sentences. It's an exam where you're going to type it out. So your time really matters when if you don't have a good computer speed. So I'll just give you an example of how the MCQ and the SAQ questions are going to be posted. So the first is your MCQ question. So we're going to have questions like how to manage a tooth with lateral luxation injury. So your options will be quite close. So one of it is the right answer here. The other one will be very closer to it, and the other two are obviously completely wrong answers. So if you see the pattern how it is, so stabilize the tooth with a flexible splint for 10 to 14 days. Stabilize the tooth with the rigid splint for 10 to 14 days again. Then stabilize the tooth with a flexible splint for 4 weeks. Stabilize the tooth with a rigid splint for 4 weeks. So if you see one is a right, the other two are completely wrong, the other one is a closer one. So the answer here is C. So stabilize the tooth with a flexible splint for 4 weeks. So your D is the closest option that you have for you to be confused. So the questions are going to be quite objective, and it'll be where your knowledge is being tested. It won't be direct most of the times. It'll all be in sentences format. There'll be complex paragraphs that will be written, but your question will just be only a very small segment of the paragraph. They might have written a big question saying, 11-year-old patient reported, the parents were anxious, they were referred by the general dentist. So all these things are unwanted information. Just have to be very precise in finding out what they are asking to you basically. So this is an example of an SAQ question. So a 12-year-old girl presents with a retained deciduous maxillary canine. The general dentist has suggested a specialist opinion, and parents are anxious when the tooth will erupt. So below that you will have number of questions. So name the 2 etiological factors associated with maxillary canine impaction. So that has 2 marks. So if it is 2 marks, you'll mention only 2 etiological factors. Then mention 4 radiographs used in diagnosing the impacted maxillary canine for 4 marks. So then you will write just 4 diagnostic methods. So CBCT, IOPA, lateral ceph, and slop technique. So you'll just have to list them 4. Then list the factors affecting the treatment decision. So again, it's going to be just 4 bullet points. So if you can go and use this QR code, this will lead you to the part 1 component of the exam website. So you can keep looking for in this page when they are going to announce the next exam. So the next exam will be conducted in Chennai. So you can look for the dates. The exam just got over recently. So they might be announcing it in a couple of months since the New Year's just begin. So you can keep looking for. In case if we get to know any information, we shall also pass it across to you. So I'd like to thank AV's Dental Academy for the opportunity, and Dr. Vinay for having me here. Over to you, Dr. Aravinth.
Thank you, Dr. Keerthi, for this fantastic presentation. Audience, if you have any queries, kindly note it down. So once Dr. Aravinth is done, you can ask them together so that we'll be able to help you out with respect to the queries. Dr. Aravinth, it's all yours.
Is my screen visible?
Yes,
Yes, Arvind. Yes.
visible.
Okay. Very good evening to everyone. We are sorry to disturb you on a Saturday night. I think most of you are busy with your practice. And I could see a lot of people joining us directly from the clinic. So before I begin, I'm Dr. Aravinth. I have cleared my MR, given my exams for Glasgow in England, and finished my PhD and got my MR from Edinburgh too. So working as an assistant professor in Coimbatore in a college, dental college here. Before I begin, I want to thank Dr. Vinay for giving me this wonderful opportunity to enlighten you people with the basic gist and information regarding MOD examinations. So, Dr. Keerthi would have given you a gist of how to prepare for your part 1 MOD. As she said, MOD examinations have two parts. That's your part 1 and part 2. So, she would have given you a clear gist of how part 1 is going to be and what are the components that are available in part 1. Sorry, 1 minute. Is my screen visible now? Okay.
Yes, Arvind.
Thank you. So, when it comes to MOT examination, you always have two parts. The first part of the examination you can complete as soon as you are done with your basic undergraduate examinations. But for taking up to MOT part 2, you have to always complete your post-graduation program, be it a 2-year program where it is done abroad or a 3-year post-graduation MBA program, which is done usually in our country in India. So you have to have a certified postgraduate program for you to take your MOD part 2. So why MOD? Basically, this examination, what are they trying to examine through this examination is that they're trying to assess your core knowledge on orthodontics, basically your orthodontic diagnosis, and at the same time your treatment plan. One of the things which Dr. Keerthi had told you people, you have to see how they approach a patient. For example, I'll just give you a small example for that. In India, we generally treat a Bimax case with an all for extraction. That is the common treatment plan which people think about, even if there is a decade 6. But for example, but there what they see is in cases where there is a decayed tooth or where there is an RC treated molars, first molars, even if it's a first molar, if it's an RC treated tooth, they will be thinking it as they will be seeing a prognosis of that particular teeth. So they are going to see a long-term prognosis. If the patient is going to have a root canal treated 6 with a crown, why should we extract a healthy premolar for an orthodontic treatment? So in that case, they'll be thinking about extracting a molar for doing that orthodontic treatment. This is just a simple example about how you should take one thing what my mentors for MOT examinations told me was, sometimes you just have to forget what you have learned in all these 3 years of orthodontics and you have to learn new. Because the way they approach a case is something different from how we approach it. It's not completely different, but because the biomechanics is going to be the same, the treatment modalities are going to be the same. But how we are achieving that treatment result is what we are going to see right now. So what they are expecting in this examination is that they are trying to assess your knowledge and how we are implementing that knowledge of orthodontics which you have learned on the patient to achieve the treatment plan. So this is the basic motto of the examination. And when you are achieving this examination, when you are achieving this degree, it is a post-nomial which is appreciated with almost everyone in this world, which Dr. Keerthi has explained already. So one thing you all should keep in mind, this exam has nothing to do with you practicing orthodontics in UK or England somewhere. Because this degree will assess your competence or assess your knowledgeable. Should be as it is something similar to an IB or diplomat examination, but it is something which you follow it to assess just your knowledge and competence on orthodontic diagnosis and treatment plan. It does not confer eligibility for the UK specialist list for orthodontics. Okay, doesn't mean when you clear your MOT examination you can go to UK and practice orthodontics. Okay. So, okay, what are the key benefits of this membership? One, that is, as everyone said, it's internationally recognized postnomial. It has access to your dental school tutors, that is the schools of Royal Colleges, and you have conferences and programs which are available in Royal College, which will be available for your discounted rate. And you also can take part in their award programs, scholarships, grants, and even election processes. So next comes why to choose Royal College of Physicians and Surgeons of Glasgow. So as Dr. Keerthi mentioned, it's a bi-collegiate exam. The exam actually is conducted along with the Royal Colleges of England. So if at all you clear your exams and you are qualified for your Royal College degree, once if you have seen my certificate which I posted earlier, this exam will actually give you a post-normal of both Glasgow and also England. So but you will not be able to use the post-normal of IMOC, RCPSG and RCS England unless you apply for it the same. So because you have to pay the subscription fee for both the colleges individually, you won't be paying it separately. So if you are going to thinking about getting the Royal College degree for England also, you have to mail them. You have to apply with your all your results and examination process along with your CV. With that, they will be conducting an election with the board where your name will be nominated, and if they agree for it, you will be able to use the England post-nominal also. So coming to MR Part 2. So when it comes to the membership fee for the entire MR is, we can consider ourselves to be in a low middle class income economy. So we will be paying either 125 pounds per year or 100 pounds per year. This is the membership fee. This is not the MR examination fee. Okay. So when it comes to membership fee, you'll be paying it once a year. It's like what to say. It's somewhat similar to an annual subscription, which you have to renew it every single year. If you are not going to pay the subscription fee, the post-normal cannot be used after that year. So when it comes to MR Part 2, the application fee is almost, when I did it 3 years back, it was around 1,750 pounds. As Dr. Keerthi said, it is 500 pounds for Part 1 and 1,750 pounds for Part 2, which comes to almost 2.38 lakhs at this point today. So the cost and the details might vary, and they have not mentioned it right now. As Dr. Keerthi said, you have to make sure you have to mail them your application forms. The application forms are always available on the website. We'll be showing you the link for the same. And once you fill the application form along with your CV, you have to submit the application form to the through email to the college. Then they'll be sending you the details regarding your MRth examinations. So coming to MRth Part 2, it consists of 4 components. I'll be explaining one components in every all the 4 components separately. We will be concentrating more on the seen unseen cases and also the theory part, and I'll be explaining it one by one. So coming to the first part, that will be your theory. In some cases, where you have cleared your MBS examination, some people might be exempted from this theory examination. That is, as in Part 1, you will have both MCQs and SAQs. In some cases, you will be exempted from this examination, from this component of your Part 2. But these things will not be decided by ourselves. We have to mail it with the CV and experience. Few people who have cleared their MFDS or few people with a larger number of experience need not to take up the theory part of your Part 2 examination. They will be directly appearing to the other components of Part 2 after they clear their Part 1 examination. One of the things when 2 years back when the examination happened online, one of the other components of Part 2 is your OSCE components. That is where they incorporate wire bendings and all other conditions. All other stations will be there. We will be performing every single, for example, they might ask you to do a wire bending like give a palatal root torque on 1-2. They'll be keeping a wire. There will be an examiner present there. You just have to go there, take the wire and do the wire bending. But since we cannot do the same thing on an online oriented exam, what they did on that particular year was instead of the OSCE wire bending components and all the type of components on that type, instead of that they started keeping an MCQ and SAQ question just like a Part 1. So how they wrote Part 1, they will be writing something similar but most advanced level questioning in their part 2 theory examinations. So that is the first component of part 2. Coming to the next component, that is in this the component they are going to expect is unseen cases, where you will be given 4 cases. That is, you will be given case records. You one minute. Sorry. So you will be given case records, be it CEF, OPG, the cephalometrics values, and also the photographs of the patient. They will be giving you all the records of the patients in photographs format, and you will be given 15 minutes with each cases. Okay, so you will be given 15 minutes and a paper and a pencil, or a paper and a pen, for you to note on the details of the cases, or you can assess the cases, cephalometrics and cephalometric values, and you write the diagnosis of the particular patient. So you will be writing the diagnosis in the formats that is explained in the books, which was explained by Dr. Keerthi. So they'll be expecting a skeletal, dental, and soft tissue finding. They'll be expecting detailed diagnosis of the patient, be it in all the planes and also the skeletal and dental component. So you carefully assess the case. They'll be giving you photographs. They'll be giving you. They will not keep a straightforward, simple case for you to just go and say the class 1 all for extraction. So you are going to explain them clearly your diagnosis, your problem list, and then you are going to explain them your treatment plan. So you will have 15 minutes of with the case record and 15 minutes with your Viva's examination with the examiner. So what is going to happen at that particular time is that, so for on a one particular day, part 2 examination sometimes happen in 2 or 3 days. So on the first day, they will ask you to go with 2 unseen cases and go for another set of component. And the next day you'll be having another 2 unseen cases. You will not be having all the 4 unseen cases at the same time. So here you will be having for every case you'll have 15 minutes of with the records, where you will be alone. One examiner will be there, and you will be just examining the case records with the photograph stuff and OPG, and you will go and explain the once you are in your Viva examination, they are going to assess your information on treatment planning, your application of knowledge, and your communication ability. That is the way you are explaining them your diagnosis and your treatment plan. So this is what they are going to expect from your unseen cases. So the next component of part 2 is your communications. So one of the important things, this is what one of the important things which they see, apart from your own treated cases and your unseen cases, this is one important component. This is one part which which eventually happen in one station of OSCE. What is OSCE? If you are not able to understand what is OSCE, it is something like you all would have gone through spotters examination during your anatomy, your oral pathology examinations. You will be running from one component, one stage to another stage, where they are kept one spotters, and you will be going to another microscope. Just similar to that, every section of this OSCE will have a separate way of examining you. One might have a wire bending. One might ask you to have a spotter to assess you what the appliance is. What similar to SAQ, how they have given you a clinical scenario, they might give you a clinical scenario and assess and ask you a few questions on it. This is how an OSCE station is going to be. And one of the important components of this OSCE station is that your communication station, where you will be given the knowledge or a brief history of a particular case. For example, I will give you a case. What they are going to give in that sheet of paper, I will give an example for that. So it is you are given a sheet saying you are going to talk to so and so's mother, the patient's mother. The patient's name is so and so, and you are going to this patient has a problem of reduced delay in orthodontic treatment, and you are going to explain the parent the consequences, what are the reasons for the delay, and how are you going to convince the patient for continuing the treatment. This is just an example. So they are going to give a brief scenario of whom are you going to talk. So you have to imagine yourself as an orthodontist who is going to face the patient's mother. So it's like acting a role. So you will be an orthodontist, and you will be facing either the patient directly or the patient's mother, whoever it is. So there will be trained actors who will be doing that part. So you will be actually facing actors who have been given instructions of how to behave. So it might be a kid, it might be an adult, it might be a parent, whoever it is. So you have to address them that way. So we will be this orientation program which we are giving you right now. This is just a small gist of information, so that you people will know how to prepare and where to start. So we will be upcoming with few other programs where we will be guiding you in every single component individually, so you will get an idea. So the third one, as I said, is communication station. You will be expected to communicate with the patient or the parent clearly and explain them. Here, the same thing, they are going to assess your assimilation of information. That is how you gather the information from the text that is given to you, and at the same time, how you use your knowledge on orthodontics and your orthodontic diagnosis and treatment planning on explaining the same to the patient. This is what they are going to expect from you in the communication session. You will have two communication in which you will be given records, that is the detailed summary with a summary for 10 minutes, and you will be you will be entering into the room or the communication station for 10 minutes each. Coming to the last component of the part 2 examination, that is your presented case. That is your case presentation. Presented case is nothing but the cases which you have done. For in MORTH examination, they always this is similar to your case submission during your post graduation. So you are going to submit your three best cases. Make sure to keep in mind they are going to assess all the knowledge you have learned. So don't try to keep cases like similar type of cases. That is all for extraction, all for extraction, or non-extraction. Don't keep cases so simple. They are not going to expect you to provide them only complicated cases. They might even see the nuances of what you have done in even a simple non-extraction case. So they are not going to say that you have to keep only this type of case and you should not keep this type of case. But one thing we could suggest is what they have suggested is don't try to keep a surgical case where you have not done many work. Okay, they are going to assess your orthodontic ability. For example, if it's a class 3, straightforward class 3 case where they have done BSSO setback, here the major work was done by a surgeon, and we have nearly in most cases we have just set an occlusion for the patient. So your orthodontic ability has not been clearly portrayed in one particular case. So you are going to give them 3 different type of cases with which they will be able to assess your ability for orthodontic diagnosis, your treatment planning, and your ability to apply the same, and at the same time your way of documentation. Okay, so they are going to ask you. There are sample case sheets. Sample case sheets available in the website. I'll be showing you clearly what are they expecting. So simple terms, they'll be expecting your pre-treatment, mid-treatment, and post-treatment records. That includes your photographs, radiographs, and models. In simple, just what type of cases you can keep is one of the example is try to keep 2-phase cases, that is non-surgical. For example, functional appliance cases where you have done some class 2 correction and so on. So even implant orthodontics can also be done, and make sure whatever you have done with clear knowledge. We'll be giving you more inputs on how to take your cases, how to start planning your case sheets, because the case sheets which we planned is going to be submitted to the concerned examination panel. So you will be submitting your case sheets along with your records, which they will be examining. And apart in that 3 cases which you have submitted, they will be choosing 2 cases with which they will be asking you questions. So they will not be asking questions from all the 3 cases. So it will be 30 minutes viva where they will be taking only 2 selected cases. That is 15 minutes on one case and 15 minutes on another case. You might even have 2 examiners. One examiner asking you questions about one particular case and another examiner asking you questions about another case. So this is an open exam, so there is no point in thinking that someone might be getting a favor, someone might not. The examiners will be different. The examination is going to be the same. Okay. So in all the parts of part 2 components, they'll be expecting only one thing. They'll be assessing your core knowledge on orthodontics, your way of diagnosing that particular malocclusion or particular treatment, or particular patient's problem, your way of treatment planning and your way of communicating that particular treatment plan to the patient and how you achieve that treatment results. So one of the things which they'll be seeing is that in some cases, I'll just give you a small input. In some cases, we might have done something which is not ideal to be done in that particular patient. For example, you might not have involved the servants in particular during the pre-treatment. During the course of treatment, you realize, but you have to make sure you accept that you have done a mistake, and you have to explain them that how you have overcome that mistake. Okay, so you have to assess what you have done and what you have done to overcome, and in some cases, how to prevent this from happening. So all these things is what one expect, because as an orthodontist, they will know that you might make some mistakes here and there, but in those cases, you have to make sure you have corrected that particular mistake. Because when you are submitting these three cases, you are going to show them that these are your three best cases, apart from all the cases you have done. And try not to submit a case where you have done some mistakes like this, because you are showing that you're in your best case, actually, you have done something wrong. So try to make sure to have cases which you have complete knowledge about from day one to day end. Okay, so that it should be the case which you have started. So you will have an idea from the day of diagnosis, till the day of debonding and retainers. They are going to even expect you to say why you chose one particular type of retainer. That is how the questions are going to be. They might ask you, why did you choose that particular treatment plan? And they will also ask you a question saying, why not choose, what are the other ways of treating this treatment? Okay, so this is the last component of part 2. So as I explained, there are these 4 components. Then this is your basic gist of your case sheet, which is available in your website, and we will also be sharing you the same. This includes all your pre-treatment, mid-treatment, post-treatment records, including your photographs, radiographs, your composite cephalometric analysis. One of the main thing you have to make sure here is you have to have a superimposition. Your cephalometric superimposition is very important, and at the same time, whenever you're choosing a case, you have to make sure you're choosing a case where there is a good amount of IOTN. I hope you all are aware of your IOTN and PAR index, and your case. Sorry. You have to make sure the case which you are submitting for your exams have a good IOTN and PAR index score. That is your PAR scores where they are compared with your pre-treatment and post-treatment scores. You have to make sure your scores have greatly improved. That is which is very important in cases. So they are going to see on the first page of your case sheet, you are going to explain what is the patient's name and details, and at the same time you are going to assess. You are also going to mention what is the patient's PAR score and your IOTN score, because according to, they treat patients orthodontically only for patients where they are in need of orthodontic treatment. Okay, so that is why they follow this IOTN index precisely. So you have to make sure that this particular patient which you have submitted requires orthodontic treatment, and that is why you have given that particular treatment to the patient. So you have to make sure you know, like top to bottom, the PAR and IOTN index and index of complexity of orthodontic needs. These are the 3 indexes which you should definitely follow. So these are the 4 major components of part 2. Then comes to the basic frequently asked questions for people who are appearing for MOR part 2. So when can you give your part 2 examination? So as Dr. Keerthi said, once you apply for your part 1, you will be given dates and details on payments for part 1. And once your part 1 exams are done, you will be given your exam results of part 1. Only if you have cleared your part 1, and at the same time, you will be submitting your completed application forms for your part 2 along with your CV and along with your case reports. That is, you have to show them clearly what type of cases have you done in your postgraduate training, like how many functional cases, how many surgical cases, how many implant cases, class 2, class 3 cases. Everything will be sectioning each case sheet, and you will be explaining it to them in a case sheet format that you have done so many cases, and you have to give sign and get that acknowledged from your head of the department or your senior from the clinic or hospital wherever you are working. So once you have submitted your application form, you will be given a confirmation whether you are eligible to take the Part 2 examination, and they will be giving you the process of how to apply for the same. So as I said, Part 1 can be given even after your undergraduate, but Part 2 of MORT can be given only after your postgraduate training. So coming to the next question, that is like, when will the examination take place? So the written component, as I said, as Dr. Keerthi mentioned, will be an online exam, because online exam it is so difficult for maybe a young orthodontist who have just cleared or doing post-graduation. It will be easier for you people to type into your laptops, but make sure people who are who are not used to laptops, make sure to sit and practice yourself with laptops typing, because you will be typing a lot in that exam, and the timing is very crucial, because in some cases, as Dr. Keerthi said, you have to make sure it is as bulleted, as precise as possible. You cannot type stories here, because in one question there might be 4 subsections, whereas in next question there might be 9 subsections. In some question there might be 10 subsections, because based on the intensity of that particular question, they might ask you 4, 3, or 5. Some I think when I appeared for that exam, it was like the sections were very confusing, because there was a canine impaction on the first question, and the third question they asked about bar score, and again the 7th question there was still again canine impaction. So it was confusing. But in the last examination, which took place recently, that question paper had components. That is, they have had side headings where they have kept canine impaction on one side heading, and they have asked all the questions coming under that in that section. For example, they have done class 2 malocclusion. They have asked all the class 2 malocclusion questions in that particular section. So this exam took place in March recently, and another examination took place in September, and the dates will be announced. They have not mentioned in the website yet, but make sure to mail them. This is the mail ID which I mentioned here. Make sure to mail them and ask regarding your what is your query, and they will respond you as soon as possible. They are out of station right in their holidays, and they'll be back by 8th or 9th, if I'm not wrong. So make sure you mail them your queries, and they respond at the earliest. Next question, for example, in some cases, you have, as I said, there are 4 components for your part 2. What will you do if you have failed one particular component? Okay, that is, you have 4 components, and they'll be giving you results. In the results, you can see clearly that you have failed in one particular component, but you have cleared in all 3 other components. If you want to reappear for the exam, the fees, you have to pay the entire fees, but you can take up only that particular component which you have not cleared. For example, you have cleared in your seen cases, your communication cases, but you have not cleared in your unseen cases. So in that way, you will be taking only the unseen cases component in your next examination. But the fees you are paying for the examination, you will be paying the entire fees. Okay. So coming to the next question, that is, what is the examination fee? As I said, Part 2's examination fee is £1,750. That is quite too much, but what I would say is it's worth the time and worth. At the end, you are going to get a world recognized post-nominal, that is your MORT RCPSG. And this will be very essential in case, if at all you are in India and you are thinking about going abroad. And you can always see that there are a lot of orthodontists come out every year finishing their MDS. How different are you from them? So this degree which you are going to hold once you clear your MORT, this degree can help you to show that you are different from other candidates. So coming to the basic examination protocol, the Part 1 examination, candidate might have cleared their primary dental qualification, that is your undergraduate level. The Part 2 examination, once you clear your Part 1, you should either have a 24 months full-time or equivalent part-time training in orthodontics. That is 24 hours full time that is the orthodontic course which takes place there. And whereas here we have a 3-year course. So once your postgraduate or orthodontic program is complete, you will be eligible to apply for part 2. So then comes your number of attempts. You can maximum take up to 4 attempts. Okay. So, and as I said, if you fail one particular component of the entire 4-component part 2 exam, you can take up only one component which you have to, which you have not clear. You can just use that and you can proceed with your exams. Coming to the next, withdrawal from the examination. So if at all you are not able to take up the exam, you have applied for everything, you have paid the fees, but due to some unavoidable reasons you are not able to take the exam, you have to make sure you mail them at the earliest, you mail them the details and stuff. Taking up the administrative fee, there are chances they will give you the refund of the examination fee amount. So if at all you go through an unavoidable situation. So that's it from me. I have given almost every information possible. We have just given you the basic information. This is a QR code which you can scan for the website details for Royal College of Surgeons of Glasgow for part 2 examination. So I want to thank Dr. Vinay for giving me this opportunity and Dr. Keerthi for presiding me, giving me all the details on part 1. And if at all any queries, you can mail us, you can directly contact us, or you can contact Dr. Vinay. He will be giving you the details of what are the programs which we are planning to do at the end of this session. And because we are planning to take up more more courses and planning to guide people on every possible way in letting them take up MORTH examinations. Over to you, Dr. Vinay.
So that was a fantastic and in-depth presentation about the part 2 MORTH orientation process here. So from respect to AV's Dental Academy, we have been focusing on a lot of Royal College examinations. Currently, we are quite established in MFDS and MFD examinations. So in case you have any queries with respect to courses regarding the same, kindly email me. I've shared the link through the email ID. Now, can we have any queries? It will be better if you can type the queries in the chat box to avoid some confusion like as to who is talking. So any queries, please do type it in the chat box. Our speakers will be more than happy to answer.
There are only 15 participants. I think it will be easier if they just talk directly.
Then okay. Guys,
you can just unmute yourself.
Unmute yourselves and ask any questions. And for those who joined late, this program will be as a recorded video available in my YouTube channel. I'll send you the link also. Any queries, doubts?
And for candidates who are interested to learn more, we are planning to conduct a full-on guidance, one-to-one guidance on MORTH, starting from your preparing your application form, preparing your cases and case sheets, and which all book to refer documentations and everything from us to the candidate. And we'll be providing you guidance in all the formats. Any details regarding this, you can contact Dr. Vinay and he will be giving you the details shortly. And we'll be forming a WhatsApp group accordingly so that we can give you the details as soon as we get it. Because we even contacted the Royal College to give us details on supportive documents. For that, we can share it to you people. So once we get it, we'll also give you all the possible information and you will be facing the examination without any fear. The examination itself is not a tedious process. The one main reason not many people take up this examination is the lack of knowledge of how to take up the exam. You all are trained in orthodontics. You all are trained senior orthodontic practitioners. The one thing is that once you get an eye opener of what all is expected from the exam, so it will be easier for you to take up the exam.
Thank you, Dr. Aravinth. Any questions? Any queries?
You guys can just be open to us. You don't have to worry if your queries are basic or anything. It's just one another person helping here. So you can just be open about your queries here.
Okay, in case you have a query later also, please do mail me. I will forward it to the speakers and they'll be able to answer.
It's
Yes,
Nandini,
Doctor.
you can unmute yourself, Dr. Nandini.
Dr. Nandini?
Trying to yeah. Can you hear me now?
Yeah, audible.
Yeah, good evening.
Good evening.
Sir, is there any time limit to be considered between these two parts? No, like should they be done consequently, or can there be any time limit? I mean, it can be taken between them, something like that.
There is no time limit as such, Nandini. You
Okay.
can give your part 1 and you can even sit in the next exam for your part 2.
Okay.
You can prepare yourself and then sit. There is no time limit.
Okay.
When you send the application, you can just apply for both together so that the process becomes easier for you.
Okay, okay, ma'am. Thank
So,
you.
as I said earlier, part 1 can be given as soon as after your undergraduate level, and part 2 you have to give only after your post graduation. That itself will give you a 3-year gap.
3-year gap, yeah.
So you will be just don't think about like will I be able to take a part 1 and part 2 together? It's not like that, because you are going to prepare the same work, and except for the case sheet, you are going to prepare for the theory part. You are going to prepare the same thing.
Okay, sir. Okay.
So you don't
It's
have
actually
to work
easier if you give both together.
Together. Okay, okay. Understood. Yeah, thank you.
Yeah, if you are ready with your cases, it's easier to go with both part 1 and part 2.
Together. Yeah, actually, I'll have to collect my cases. That's why.
Then it's okay. Then you take your part 1 and you will get a confidence that part 1, if you have cleared your part 1, you will also get a confidence that, okay, it's not as severe as thought, and you will be able to concentrate more on preparing your cases for part 2.
Sure, sir. Sure, sir. Thank you.
Anybody else? So, can we end the session?
One thing before ending the session, so you have to make sure not to think too much. Don't worry, because it's not a very complicated exam. You just have to go through your basic knowledge on orthodontics and the way how they approach the cases, so that it will be easier for you to take over the exam. And please feel free to ask any queries. And if you're not able to ask now, make sure to note it down and mail it to Dr.
We
Vinay.
have a query in the chat box. So they've asked saying, regarding pre-treated cases, is it possible to manage them in your private clinic, or it should be done during your study? You can have any cases. There is no restriction. It need not be guided. You don't need to have a guide for your case or anything. It's just that you need to have a proper documentation of your cases. That is mandatory. So even if you're doing in a private clinic, you should have all the photographs, stage models, and everything being documented very meticulously. That's all is needed for the exam. You don't even need to have a guide for your cases.
Because they are even going to ask at what month and year you started this case. Like for example, Jan 2024 I started this case, and March 2025 I started with retraction for this patient, and April or in my July or August I started with settling. They are going to ask for that. It's not, they are not going to examine your photographs for the dates. It's just that proper planning should be there. You should be aware of what you have done and when you have done. As ma'am said, you need to have a proper documentation. Does that answer your question, Dr. Dima?
So, thank you all for your patient listening. We'll be sending mails regarding the courses and how it works. So please do feel free to approach us anytime, and we can help you out with your MORth, the prestigious MORth degree. Okay. Thank you, guys.
Thank you all. Happy weekend.
Happy
Thank you,
weekend.
Vinay. Thank you, Aravinth.
Thank you.
Thank you, Dr. Keerthi. Thank you, Vinay.